Hello, friends. I'm so excited to be going live with Nikki today with the Belle method. So just hang on and we will get started. Hey,
Hi.
How are you?
Yay! I'm just fiddling with my tripod here. I'm doing well. With it.
Hustling through
Mad
traffic.
Welcome to Toronto. For those of you who don't know, it's like 5 million people who live in the city, and the traffic is horrendous. It's like LA traffic.
Oh my goodness. Oh my goodness. What is your weather like right now?
It's nice. It's gorgeous. Yeah.
Good.
It's gorgeous. Thankfully.
Excellent.
Yeah. It's going to get cold really soon, but not yet.
Yeah. You can hear me okay?
I sure can. Yeah. Can you hear me okay?
Yes. Great.
Okay, cool.
Great. So how about we start off with you giving a little bit about your background and who you are, and just welcome everyone that's here. And we will be recording this and uploading it to our YouTube channel. It's called My Pelvic Floor Muscles, no spaces. My Pelvic Floor Muscles.
Awesome. Cool. All right. Finally, hopefully I don't make you guys motion sick from this whole.
You're good.
Cool. Yeah. All right. So I'm a Pilates teacher. I'm very passionate about pelvic health. And whoop, did you fall over? Sorry, guys. This is classic. I literally ran in the door, kissed my baby, said okay, bye, and then came in. So as I mentioned, I'm a working mom, as you can tell. I'm just gonna hold the camera. Okay, that's better. So I'm a working mom, and I have a 16-month-old. I'm very passionate about the pelvic floor, and I've been teaching this stuff for about 12 years now. And so it actually started, I got into Pilates because I injured my knee. I was a dancer, really common story. You know, we discovered Pilates because it really helps us rehabilitate our body. Mm-hmm. And then I got into fitness because in Pilates because I loved what it did for me. And I started working out of a physiotherapy clinic, and I learned a lot really quickly.
Nice.
As soon as I graduated. Yeah, so I was I was learning really, really quickly with people who knew much more than me, which is like the perfect situation, right?
Just be a sponge.
100%, 100%. So I've become really passionate about it, and I recognize so much how important this conversation is, especially for women. I remember teaching boot camps in my mid-20s. I'm now in my late 30s. And I remember women just being like, oh, I can't do that move. I'm not wearing a pad. Or I'm not wearing a liner. I can't do, those jumping jacks or whatever it might be.
Just kind of accepting it.
Yeah, I was like, this isn't the way it's supposed to be. And so it made me want to dive deeper. And I have. Yeah.
Yes. Excellent. I love that there are so many pelvic health advocates that aren't just pelvic therapists, Totally. I mean, there aren't that many of us, but we're growing in numbers, but it's amazing to be able to connect with so many fitness professionals and various walks of life. You don't even have to have a formal education to be a pelvic health advocate and to bring up the conversation within your sphere of influence. You have no idea, just, hey, did you know there was something for that? Hey, you're still having pain with sex. Hey, just being the little ray of hope.
100%. And I'm very fortunate that my mentor is Dr. Sinead Dufour here at McMaster University. You probably heard her name on some studies. So she was my
sounds familiar.
Mm-hmm. Yeah, she's amazing, and I've been mentored by her as well. So I feel very fortunate that I've had researchers, PhDs, people that have really helped guide me. And it's really informed a lot of the work and the methodology that I've created as it relates to Pilates meeting pelvic health.
Cool.
That's kind of what I do. Yeah.
Good. Excellent. Well, shall we jump into some of the questions?
I think that's a great idea.
There was a lot of really good questions.
A lot of questions. Oh my goodness. Okay. So I wrote a few down, and want to go back and forth? Does that work?
Sure, yeah. Mm-hmm.
Okay. So one of the questions, I got a lot of questions about prolapse. So a lot of people saying, what can I do to prevent prolapse? And then a lot of people saying, I've done pelvic physio, why do I still have prolapse? There were sort of how come, I think one thing that we need to explain is, first and foremost, what is pelvic organ prolapse and how it can be in different grades, right? And what can cause prolapse. And, and there's a lot of information that can be fear-mongering for women, don't lift that, that's too heavy, you're going to give yourself prolapse. So I think maybe clearing the slate and talking about that would be really helpful.
Sure.
Yeah.
So basically prolapse there can be multiple things that prolapse, but basically prolapse is a descent of the pelvic organs. I have a little, I rotated a little bit.
It. Props. This is the best.
Yes, I love props. Okay. So let's pretend like this represents the bladder. And so you have 3 organs generally in females, the bladder, the uterus, and the rectum. And they each have a canal. So they have 3 canals. And so prolapse, pelvic organ prolapse, is where one of the organs or more is falling into that vaginal canal. So I wish that I actually could show it falling into the vaginal canal, but just imagine there's a vaginal canal here and the bladder is falling into it. And so you won't actually see the bladder. It's the wall of the vagina that's collapsing. The bladder's behind it, and it can collapse just a little bit where it would be really, really hard to see it because it's still inside the vagina. It can collapse a medium amount, and then it can actually bulge outside the vagina. And you can have multiple organs that prolapse. So that's the bladder. You can have the uterus. You can also have the rectum. And you can have 1, 2, or 3. And then also the intestines can prolapse as well. So can pelvic floor physical therapy fix all prolapse? No, we can't fix all prolapse. But there's really exciting research to show that we can reverse some stages, and even in some of the more severe stages of prolapse, that we can help you be asymptomatic. So in this really cool study by Dr. Kari Bow and her team, I believe it was 74% of the women with a stage 3. Man, I wish I had that statistic. I wasn't prepared to go into those stats here. But certainly I can get it for you. But I think it was 74% had significantly less symptoms or symptom resolution. So that's the main symptoms with pelvic organ prolapse are the vaginal bulge and the pelvic heaviness. There can be other symptoms too, but those are 2 of the hallmark signs. And so if by doing pelvic floor muscle training, if we can reduce or eliminate those signs, then that's fabulous. Yeah. There's certainly more that can be done though with pelvic organ prolapse. So pelvic therapy involves, I'm a huge advocate of support. So look at how many options we have to support our belly and our baby bump, right? I mean, they're all over the place. How much are we talking about supporting our pelvic floor from below? So I have another little model here. So here's the pelvis.
Amazing. Mine's right here. She's right here.
So, hey, we can kiss. Our pelvises can kiss. That's super. So imagine, whether you had a vaginal delivery or a cesarean section, that pelvic floor goes through a lot during pregnancy. So think about how much weight it's having to carry. So number 1, let's think about supporting the pelvic floor even during pregnancy from below. Okay, and then postpartum. Okay, so we have a baby coming out of the vagina. How much stretch is happening to all of this tissue? And potentially you have a tear or an episiotomy where the opening had to be widened, right, for the baby to come out. So supporting, if we had any other muscle that was cut or torn, what are we going to do to help support? So support externally, support internally, and then pressure management and breathing. So I'm sure that you incorporate a lot of that into your classes. So what are some of your suggestions and tips in terms of how do you incorporate that into Pilates?
Yeah, so I think one of the things that I find is that women need help with their breathing mechanics, which I'm sure is like the number 1 thing we focus on. We have a tendency to often breath hold, especially if we're feeling anxious, and pregnancy can be an anxiety-inducing time for a lot of women. Sometimes as it relates to the way they sit at their desk, if they've got posture and they're not able to get their diaphragm moving. The point is that if you're doing a lot of sort of upper chest breathing, you're actually messing with the way that your diaphragm and your pelvic floor are supposed to be working synergistically. And so by breathing up into your shoulders, you're actually causing more pressure on your pelvic floor, and it's not working optimally.
We're not
working optimally. And so we really get women to, and at first they're kind of like, what do you mean all we're doing is breathing? I'm like, we're not only just doing breathing, but we need to start here. It's sort of like a building block. We need to start understanding how to breathe correctly, and then we're going to move on, and layer more challenge moving on to that. So number one thing is learning how to breathe correctly. And when I say breathe correctly, I've done a ton of videos on Instagram about that, but it's essentially a diaphragmatic breath. Inhaling, allowing the pelvic floor to gently release and drop. We think of the jellyfish opening. Exhale, feel like it's drawing up. So there's this dynamic action happening. If you're breathing into your chest, you're not going to be getting this. It's going to be kind of like, a little bit. You're not
or if you're holding your breath even, that can be pushing down.
Yeah.
So think about how much... Wouldn't that be crazy if my balloon popped on me? Because I do have water in it.
Really? That's amazing. That would be really fun.
Yes, I was just thinking that. Okay, that was a side thought.
And sucking in, right? Like also from the perspective of a former dancer myself, we're always taught, like, don't let your belly hang out. Like, we're kind of ingrained in our culture to kind of suck in, keep it all held in, wear your Spanx, whatever.
Yes.
And so... I feel like that's, as you even mentioned, when you kind of suck in all the time, that actually has the effect of putting downward pressure on your pelvic floor, which is a risk factor for prolapse over time. So stop sucking in, ladies.
Exactly. So we want to strengthen in layers. So you have multiple layers in your abdominals, and we want to build from below. So the six-pack is not the goal. Hey, if you get a six-pack, great. But let's strengthen from below, because you can have a six-pack and still be weak.
100%. You could probably still have a six-pack and prolapse, right?
Yeah, right.
Yeah. Cool. So
because you can still have
conversation.
Yep.
There's so much we could do a conversation just on prolapse, but I guess we kind of like do a bunch.
Yes, that return to running. So I have some. So basically, how do you know postpartum if you're ready, if your pelvic floor is ready to return to run? So a few things that I would just use as warning signals: if you're having pain, if you're having prolapse, if you're having leakage, urine or fecal or gas that you didn't intend to come out at that time. Those are some warning signs that you're probably not ready to begin running. That doesn't mean that you can't start exercising. So it's very important to begin exercising before that 6-week mark. So some people are like, oh, I'm not going to start, I'm not going to start until 6 weeks. No, we want to start soon. And how soon can you start exercising your pelvic floor? Well, that's really kind of individual, but we want you to connect with that quickly. So if you're mentally with it enough that you can start on day one and just begin some gentle squeezing and releasing and breathing, I love that. But if it takes you a few days to get that connection, that's okay too. You just went through a lot. So eliminate some of the pressure and stress. Okay. Some hallmarks of actual pelvic floor function. So we, as pelvic therapists, we do internal assessments of the pelvic floor, and we have muscle grades. So it's called manual muscle testing, and we can test, physical therapists, and I'm sure other disciplines too, test multiple joints and muscles all over the body, right? So we use the same muscle grading scale, but we apply it to the pelvic floor. So 0 is no function and 5 is normal function. And I'm going to actually make a post on this too. But good. Okay, so at least a 3 out of 5 on that muscle grading scale. So how are you going to know if you have a 3 out of 5? You're really not, because I'm not saying you specifically, but as a postpartum mom, how are you actually testing your pelvic floor? It's kind of tough. We actually recommend that everyone, if possible, see a pelvic therapist afterwards, even if you're not having symptoms, just to be able to get some of that information and get an assessment, see where you are, and then you can start an individual program. So number 1, 3 out of 5. Number 2, there's this, it's a prolapse grading. So it's called GH plus PB. And so we're testing the level of descent of the perineum. And so it needs to be less than 7 on Valsalva. But by the way, this is all coming from Absolute Physio and Physio Mom UK and Running Physio. They created these postpartum running guidelines. It's a 40-page document.
Yeah, I have it. It's amazing.
It is free. Yeah, and I sent you the link. So maybe I'll post it in my story, and then if you can post it for your... Yeah, exactly. I have it pulled up on my computer too. I have it's a favorite. So it's free. Go to Absolute Physio, and if you go to the link in her bio, you can get those guidelines. Cool. But that's where all of this is coming from.
It all came out only in March of 2019. Like,
yeah, it's current. So they spent a lot of time developing this, and it's huge. I love these. Okay, so you're looking at the manual muscle testing, the pelvic organ prolapse, and then pelvic floor muscle endurance. So number one, quick flicks. So you want to be able to do 10 quick flicks, but a quick flick infers that you're squeezing and releasing. So think about that pelvic floor, squeezing and releasing. So if you're just squeezing, you may not be ready. You need to be able to have that full function of the muscle. And then 6 to 8 second hold, 8 to 12 repetitions. And this is standing, like this is anti-gravity. This isn't lying down. So if you can't do this anti-gravity, then why are you going to put your pelvic floor through all this stress of running? Because think about what happens when you run. I don't have that example, but your pelvic organs are here and something has to hold them up, and it's the pelvic floor. And so as you're running, pelvic organs are landing on the pelvic floor over and over and over again. You get my point. So we need this pelvic floor to do its job in supporting. Okay, and then the third one is a 60-second sub-maximal contraction. So being able to hold it for 60 seconds. And we use biofeedback or other technology to help assess that too. It's a very helpful tool. Many therapists do. So that's some objective framework that you can use to determine if you're ready to return to run, and again, go see a pelvic therapist. At the end of their guidelines, they have a graded progression. It's called a couch to 5K. So they take you through week by week kind of what you should be doing or what you could be doing. These are guidelines, so not everyone falls within it, but it's a general information that's very helpful.
And one of the things I remember, I did an IGTV video on it. One of the things I find that's really good for people to know is that it requires a lot of unilateral glute work. So,
the hopping.
The hopping. The ability, because essentially, if you think about it, running is just hopping from one foot to the other while going forwards. Yeah. So you need to be able, first of all, start with single leg bridges. So lying on your back, one leg in the air, like this is my Pilates brain, like helping people progress.
Good.
And then can you get from, say, sit on a chair, lift one leg up, and get out of that chair with only one leg? Like these are hard things to do. But
they are hard to do.
They're hard. And then can you jump, literally hop like a bunny on one leg without leaking? And if you can't do that, then you're not ready to run.
You're not ready, yeah. In our stories, I have something called, I think it's called postpartum running. And so we've done some demonstrations on some of the, because they take you through these different scenarios in the postpartum running guidelines that they created. So we've actually acted some of them out so you can see real life.
I'll check out your stories. That's great.
Yeah.
It's great.
My 17-year-old daughter helped me be the model. So she did great. Yeah.
I love that. That's awesome. I love the perfect analogy for pelvic floor strength. So I think people are often thinking, I just need to do Kegels. We had a lot of questions about Kegels. Is that it? And I know you're not a huge fan of the word Kegels because there's a lot of people.
There's so much more. There's so much more.
Mm-hmm. But it's true. And one of the things that I'll kind of explain briefly what my take is on it, and then I'd love you to jump in. But Kegels are essentially, I was taught, hold your pee. I was taught like a Kegel is just when you're going pee and then you hold it, and then that's your Kegel. And you can practice it when you're driving or practice it, like do your Kegels all the time. And I now teach students, actually, it's better to do it in more of a meditative way. Like you don't necessarily
intentionally.
Like don't do your Kegels like, at every stoplight or, like while you're driving to work. Like it's more of something that I cue people to try to do sort of like as they're falling asleep at night or a time when they can be a little bit more present and they don't have to be multitasking like on the highway. And then one of the things too is I really love is the analogy perfect to explain that it's not just like as simple as, and you touched on this already, it's not as simple as just like squeeze, release, like power, endurance, repetition, like fast, coordination, and timing, right?
There was another question on what is the ideal pelvic floor muscle training scenario? Rather, like how many should I be able to do? What does the ideal program look like? So I'm going to go back to some guidelines because I can have my opinion. It's going to vary based on what your baseline is and what you can do. But this book, I call it my pelvic floor Bible, okay? So this is written by Dr. Kari Bow and her team, Evidence-Based Physical Therapy for the Pelvic Floor, and it's on Amazon. So I'm just going to review some of her clinical recommendations specifically for a pelvic floor muscle training, then I have a couple things to add there. Amazing. So make sure that you're correctly contracting, okay? So when you correctly contract, the openings should close and the floor should lift, okay? So that's number one. Ask the patient to contract as hard as possible. So we're not just doing baby little flutters. We want to squeeze. All right. Progress with sustained contractions and add contractions with higher velocity as a progression. So squeezing and then even doing some quick flicks at the end of that squeeze. And a really cool thing with biofeedback, whether you have a home unit or a clinical unit, is that you can see the electrical activity of the muscle. So I think that's one of the best things about biofeedback is that it connects you. You can see what you're doing. Yes, you can see a little bit with a mirror. Yes, you can feel with your finger, but to be able to give some specificity there, and I find it an invaluable tool. I am a biofeedback fan, but not alone. It's a tool that a skilled person should use. Okay, so number 4, holding time should be 3 to 10 seconds. So how often do people talk about holding? So we want to have a good strong hold and hold it 3 to 10 seconds. Encourage and motivate patients to get as close to maximum contraction as possible. Use strong verbal encouragement. So squeeze and hold it and squeeze. You don't underestimate the power of encouragement. Okay. Recommending pelvic floor muscle training every day and then advanced eccentric contractions as possible. And then also remembering that strength training develops in steps and that the largest improvement happens at the beginning. And as you continue training, that you'll have to work harder to achieve improvement. So the 3 things that I would add to that are making sure that you're relaxing. So a correct contraction and a completely letting go. So think about your fist. You're squeezing. Great, you can squeeze well, but you've got to be able to release too for function. And if your fist is squeezed hard over time, it's going to lose function. So we've got to have both phases. The second thing is the position. Fabulous if you can do all these things lying down, but that's not functional. So we need you to be able to do it in an anti-gravity position and even challenge that anti-gravity position. So a squat or a single leg stance or uneven surface. There's a lot of different ways that you can challenge. And then number 3 is function. So being able to apply and engage the pelvic floor functionally. So again, wonderful if you can engage it intentionally, but are you able when you lift your baby? Is your pelvic floor engaging? Are you practicing function? So that's kind of my I love her and her research. She's a super, just a great therapist and has done so much research, and especially in the terms of pelvic organ prolapse. She has a lot of stuff. So
there's one thing I wanted to add on to that, just in terms of how I explain it, because I feel like one of my skill sets is that I take this sort of like, we'll call it somewhat academic information, and I try to trickle it down in a way that it's really absorbable.
Connect with people.
Get it, right? So people are like, well, I thought, especially in the fitness world where I'm coming from, everyone's like, I thought tight was good. I want to get tight and toned. I want to get tight is an adjective that's desirable in the fitness world. And I'm like, I don't use it in any of the descriptions of our classes because I'm thinking, no, we want function. And so I love your fist analogy, right? If you're tight, people are like, but I want my pelvic floor to be tight. And I'm like, no, you don't. And the reason for that, the reason you don't want it to be so tight is that I usually give an analogy of like a 10-story building. So you want to be able to go in your elevator from the ground floor to the 10th floor and back down to the ground floor. If you're living permanently on the 4th floor, okay, you can only go up to the 10th floor and back down to the 4th floor. 10th floor, 4th floor. That would represent a 60% contraction. So
and you may not even be able to get to the 10th floor if you're living at floor 4.
There you go. So and that's just the simple way I try to say that, like, you actually before, and this is for a lot of the women who wrote in after having C-sections, or even saying, I'm having a planned cesarean, I'm worried about what can I do right now to prepare for that. I often would say to them, learn to first see a pelvic physio, and then learn about understanding, are you able to get full range of motion in your pelvic floor? Can you fully relax, and can you fully release or fully engage? Because if you're here, it's sort of like, this is your contraction. You want to have that full range. You want to be able to go down all the way up and then all the way down versus just kind of hover between the couple floors.
And strength and overactive are not synonymous, okay? So a strong muscle is good. It's going through that full range of motion. An overactive muscle is hanging out right there at the top, like at floor 4 or 6 or whatever. So that's a great analogy. One, I know we're running out of time. So there was quite a few questions about overactive pelvic floor muscles and what to do. So I like making that mind-body connection, breathing, and another super favorite of mine is perineal massage. So here's the perineum. That's the vaginal opening and the anus. And these are actually pelvic floor muscles, but they're covered by skin and fascia. And so massaging this externally, and then you can also go internally in a relaxed position. And really depending on where you are. So do you have a scar? Are you postpartum? Are you pregnant and you're trying to relax your tissue and muscles for delivery? So there's different intents of perineal massage, but perineal massage has been shown to reduce postpartum pain with sex. It may reduce the risk of episiotomy and tearing, especially in first-time moms. So is it a magic for everyone? No. But is it a tool that has been shown that it may be effective in some cases? Yes. And if you're having overactive pelvic floor muscles, I think that's a very, very effective tool, because if your shoulder's tight, okay, we're going to stretch, but it feels really good to do some massage there too. So,
totally.
It's okay to touch your muscles. It's okay to touch your tissue.
It's
get
like
connected with it.
Not. People are like, I had someone reach out the other day. She didn't realize that she could have an imbalance in her pelvic floor. That she's like, how could it be that my right side is so much tighter than my left side? And that tension in the right side was causing pain in her right hip and in her right lower back. And of course, a lot of the times you might go to a practitioner who doesn't specialize in an internal area of the body, and they're looking at it from the perspective of your spine, or, and they're not the root. If the root problem is internal, you need to get it. It's like a knot. You need to get that released. We'll take a little view inside the pelvis here. So this is the pubic bone, and then here's the wall of the pelvis. And this is a muscle here called the obturator internus. And that's a big culprit of hip pain. And it can also be a culprit of some other dysfunctions too, but hip pain is a huge one there. I'm actually posting a stretch for the obturator internus on a post very soon.
Good. One other question I remember was about pubic symphysis pain. Like, why are you still having pubic symphysis pain? So going back to our model here, and you have this little disc of cartilage that's in between the two bones here. And a common cause of pubic symphysis pain during pregnancy is that cartilage is expanding, right? So the pelvis is expanding, and sometimes, so it's, there you go. So it can rotate. Yeah, I know. It can rotate so the pelvis can actually be imbalanced. And so think about trying to walk on a rotated pelvis. That can be very, very painful and give a lot of problems. And the same thing can happen postpartum. So making sure that your pelvis is stable and even in good alignment. And then if it is, it may still be kind of hypermobile or wiggly. And so you may need some external support there to give some compression, some gentle.
Lots of glute work. And
lots of glute work, yep. Symmetrical glute work. So that's not the time that we want to be doing single.
No, yeah.
Right, single leg bridges.
I follow a lot of Cecile Roost's work, the Dutch physical therapist.
Okay.
And the book that she wrote on pregnancy pelvic pain. I found a lot of the exercises that she has with butterfly stretch followed by bridge with the squeezing of the knees together has been really helpful for me.
Yeah, to kind of set.
Yeah.
Good, like reset. That's great.
Totally, like a pelvic symmetry.
Yes, I love it.
Yeah.
Okay, well, we'll have to do this again another time because I know we have more questions, but I think we hit the highlights of most of them.
Yeah, there were a lot of repeats for sure. And then, you know, and if you guys are watching this, and I think you mentioned also you're going to save this video and we're going to replay it because some people wrote in they weren't available right now to watch it.
Yes.
So it's going to go onto your YouTube channel?
Yes. My pelvic floor muscles, no spaces. And we'll connect again. Thank you so much for your time. Thank you, everybody, for joining us, and have a great day. Take care.
Bye. Thank you. Bye.
Bye-bye.